So the second question, 2 minutes, and we're going to start with MaryAnne, and we'll just keep going. But you knew this was coming, so it's okay. And this is the opportunity for you to say, now that you've thought about what your sector should do, now you can let loose on everybody else. So what do you want to see in this report?
I need more minutes for that.
And that's it. So it's your number one, and if you have to, your number two. But your number one and two things that you want this report to emphasize to help us move forward.
You know, I've heard some great things today that I know are going to be in the report. Some I'm not so sure about yet, so let me go through my little list. So I've been happy to hear about the emphasis on person-centered care, educating and training family caregivers. One thing I haven't heard, use of plain language. We have got to get back to an emphasis on health literacy in this country. I have heard about integration of social services and other community supports. Check that one off. Not so much about care plans that have been created with family caregiver input. You cannot have a care plan for a high needs patient, one who does have a family caregiver, without that caregiver's input. A couple things I again, haven't heard a whole lot about, and I want to. Care transitions, palliative care, and the 800-pound gorilla in the room, complex patients who also have dementia. So our current healthcare system is not dementia-friendly. Let's just call a spade a spade. Dementia is a game changer and needs to be addressed separately. Models and solutions that work across other chronic conditions are going to fall apart when applied to a patient who also has dementia. Having 3 out of 4 parents with this disease quickly teaches you this. I got more minutes?
20 seconds.
All right, a word about care transitions. I want to throw this in here because this is where the wheels fall off for family caregivers like myself. Between November of last year and March of this one, we experienced 7 care transitions with my 85-year-old mom, the result of injuries sustained in a fall. Each time I had to drop everything, work, life, the whole 9 yards, and oversee each transition. Why? Because I embodied the only comprehensive medical record my mom had. Apart from the partial records housed at 3 different hospitals, a rehab facility, an assisted living community, a nursing home, 2 primary care offices, and several specialty practices. Some paper, some electronic. Because nobody had a correct list of her medications, because nobody wanted to deal with her dementia, because nobody communicated. This is reality for so many adult daughters today. So I'll leave it there.
Excellent.